You're listening to Civic from the San Francisco Public Press. HIV activists and healthcare professionals are warning city officials that while everyone is paying attention to COVID, rates of HIV infection and HIV-related illnesses have been creeping in the wrong direction.
And right here in San Francisco, we have people dying with Hep C. We have people dying from HIV. This is a reality. We can't be silent. And sometimes you feel trapped in the stigmatism. And even though it's 2022, ignorance is so real still. But how do we fight ignorance? Well, one way is we're gonna break the silence. We can't be silent anymore because silence equals death.
I'm Sylvie Sturm, and this is Civic. Dozens of HIV survivors, activists, politicians, and healthcare providers assembled at City Hall on March 21st to hold a die-in. Rally organizers were sounding the alarm that while city officials and the public were all focused on COVID, the campaign to achieve zero new HIV infections and zero deaths by 2025 was falling behind.
I'm Michael Rupe. I'm with the Harvey Milk LGBTQ Democratic Club Executive Board. I'm a long-term survivor with HIV. I have been living with the virus. We've survived now 2 pandemics. And what we're seeing happening with the recent epidemiological report is that San Francisco is losing the opportunity to be a trailblazer. We are committed to getting to zero, and that means we have to renew our commitment to HIV and the battle against AIDS. I think the city got really walloped by COVID, and all of our attention, time, and resources were diverted to avert a catastrophe. And we're here today to ask for solidarity, to renew that effort, and commit to coming back to fight HIV and join us.
The rally was also an opportunity for survivors to share their stories and their grief. Among them was Junebug.
And right here in San Francisco, we have people dying with Hep C. We have people dying from HIV. This is a reality. We can't be silent. And sometimes you feel trapped in the stigmatism. And even though it's 2022, ignorance is so real still. But how do we fight ignorance? Well, one way is we're gonna break the silence. We can't be silent anymore because silence equals death. But sound and support and treatment and a cure equals what? Life. Equals what? Life. Equals what? Life. So let's end HIV. Let's end Hep C. Let's end stigmatism. Let's end discrimination. Our community is living in silence and dying alone. People are living in garbage. And it's not okay. It is our responsibility to take care of each other. We are each other's keeper. I am your keeper. And I am here to break the silence. And I am going to do something. I will break the silence. I tested positive for HIV in 2009 when I was pregnant. And I have never been able to get on a mic and shout it to the world. But I am here to break the silence.
San Francisco's first cases of what came to be known as HIV/AIDS were diagnosed in June 1981. It was a time of uncertainty and increasing horror for the hardest-hit community. The poem Tornado by long-term survivor Hank Trout is an excruciating account of what it was like. Harry Bro, a long-term survivor and HIV activist, read the poem during the City Hall rally.
We survived the tornado because we held each other as tight as we could, as long as we could, no matter which one of us was sick. Because we shopped for each other's cheese and asparagus at Trader Joe's. We picked up each other's meds at Kaiser. We dusted each other's apartments and disinfected each other's bathrooms. We laundered each other's sweaty bed sheets and hauled each other's Labradors and Terriers to the groomer. We returned each other's library books and blockbuster videos. We hid each other's porn stashes from nosy mothers. We fed each other hot and sour wonton soup from the corner dive, or bear claws from that Polk Street donut shop, or homemade chicken soup from heirloom recipes. We changed and cleaned each other. We dressed each other for doctor's appointments or a night on the town. We undressed each other for a soak in a hot tub or a cuddle before sleep. We licked each other's tears and salved each other's wounds. We made art together. We sewed a quilt so no one will forget our names. We wrote poems about the men with night sweats. We told stories about long-term companions and early frosts. We made plays about American angels and normal hearts. We painted faces screaming in pain and photographed lovers shrinking in repose. And we loved each other, gently, tearfully, fearlessly. We loved each other. And we proclaimed that love sacred, and it was.
From the very beginning and throughout the HIV epidemic, San Francisco led the way in prevention, care, and treatment that came to be recognized around the world. One of the city's top leaders in HIV healthcare talked to us about the significance of San Francisco's influence historically and to the present day.
My name is Dr. Monica Gandhi, and I'm a professor of medicine and infectious disease doctor at UCSF, but the specific role that I have at UCSF are very integrated with HIV. I'm the medical director of Ward 86, which is, we think, one of the oldest HIV clinics in the country. And this is based at San Francisco General Hospital. And then I'm also the director of the Center for AIDS Research at UCSF, which is an umbrella organization covering a lot of research enterprises we have here. The first description of AIDS ever was in the CDC MMWR on June 5th, 1981. And that was these descriptions of these young gay men in San Francisco, LA, Philadelphia, New York, Miami, with these terrible illnesses of immunosuppression. And that was our first introduction to what was happening with AIDS. And after that first description, opened up a designated AIDS clinic called Ward 86. It's the sixth floor of a building called Building 80. So that's where the Ward 86 name comes from, on the San Francisco General Hospital campus. So it was a year and a half after AIDS was first described. I really do think it's the oldest HIV clinic in the country. And about a year after that, opened up a designated inpatient unit across the street in the hospital for taking care of people with AIDS.
Dr. Gandhi was drawn to both the science and the social justice around HIV because she could identify with the marginalization faced by the gay community.
So personally, I, actually was an Indian American that grew up in Utah. And in the early 80s, I was in middle school. And then when HIV was being talked about, I had some friends who were gay who were coming out in high school and very stigmatized for that in a relatively conservative community where I grew up. And I became really interested in stigma and feeling othered, and also feeling othered being an Indian American in Utah. And I really became involved in HIV movement, not just the science of it, because I did end up going to medical school to pursue HIV, but the politics of it, the advocacy, the activism, the social justice aspect of HIV. And there was nothing else I wanted to do but to do HIV when I went to medical school, and then really made a beeline to UCSF for my residency, because this to me was the place. San Francisco was the epicenter of the pandemic in the United States, and it was the place where so many innovations happened, and there was so much acceptance and so much less stigma of being at risk or having HIV. So I wanted to be here. Ward 86 has now, been around since 1983. I became medical director in 2014, but it's sort of known for innovations in care. We did a lot of clinical trials. At the beginning, investigational trials of the new HIV drugs, and then later was the first clinic to put everyone on HIV therapy regardless of T cell count in 2010, at a time where people were deciding to wait until CD4 counts were lower, and then started different innovations from there.
In 2016, the city launched a bold new initiative called Getting to Zero. The goal is 0 new HIV infections, 0 HIV deaths, and 0 HIV stigma by 2025. The strategy calls for 3 initiatives. The first is the expansion of PrEP, or pre-exposure prophylaxis, a daily pill that reduces the risk of HIV by 99%. The second is called RAPID. The program allows newly diagnosed HIV patients to quickly access antiretroviral therapy through several clinical hubs around the city. The third initiative focuses on retention, making sure that patients with unstable housing, mental health issues, or suffering from addiction still regularly engage in HIV care and treatment. The strategy was showing signs of success every year. By 2019, the Department of Public Health's annual HIV epidemiology report revealed that new HIV diagnoses had dropped to a record low of 166, down 19% from the previous year. Nearly all the cases were linked to care within a month, and within 6 months after the diagnosis, 78% were virally suppressed. That means that the amount of HIV in the body was minimal enough to keep the immune system working and prevent illness. But that trend began reversing course during COVID.
What happened was that the shelter-in-place order, when it went into place around March 16th in the city, the next day we were told that we needed to close outpatient clinics for in-person care and convert to telephone medicine. And that wasn't something that worked well for our patient population, because the patient population that we particularly serve at Ward 86 is publicly insured. 34% of our patients are marginally housed, a lot of substance use, and a lot of people who don't have nice, quiet places to sit with a phone to call into a doctor. And it wasn't working for our patients. In fact, after about a month and a half, we were bringing people in for their viral loads, and we saw that already our goal of therapy was slipping, which was to achieve virologic suppression in our patients with therapy. Patients taking the therapy, getting their viral loads down to undetectable, those rates were slipping. And so I, as the medical director, actually made the decision to open up for in-person care as much as possible, keeping our staff safe with masks and distancing and ventilation, but kept the clinic open. And that reversed that trend. And we, in fact, saw higher rates of virologic suppression during the pandemic than we did before. But that trend wasn't seen in the city. Actually, the city had started out prior to the pandemic with a 75% virologic suppression rate, and it went down to 70%. And then in the homeless, it went from a 39% virologic suppression rate, which was already really poor, down to 20%. So only 20% of our people living with HIV who are homeless in the city of San Francisco have achieved that goal of therapy of having virologic suppression. So the slippage was very obvious. So HIV care went down, and then concomitantly so did HIV funding, because a lot of the resources were being diverted to COVID. And importantly, so were the people, meaning people in the public health department who would usually think about HIV were thinking about COVID. So a lot less attention paid to these milestones of HIV that used to mean a lot to us.
And what happens to patients whose virological suppression is no longer at zero?
It's a dual problem, because the patient themselves can progress to AIDS and will start doing poorly. So we saw a lot of people being admitted to the hospital with opportunistic infections and who were quite ill because their viral loads were up and subsequently their T cells were down. So we really did see a lot of poor outcomes, unfortunately. And then second is that there is a risk of forward transmission to the community. If you, as someone living with HIV, doesn't have an undetectable viral load, then the infection can spread. So there's a risk of onward transmission. So there's sort of a public health implication of that as well.
Have we seen sort of a higher rates of transmission?
It's hard to tell, and I think it's only now with this movement of back to HIV that we're going to be able to see this, because our HIV testing rates are still not back up to where they were pre-pandemic. They're about 44% down at least. And so the only way to know if people have HIV or if there has been more transmission, is to do a lot of testing, just like COVID. So we need more HIV testing to be happening at community sites, in the ER, at urgent care settings. I will say anecdotally, we've seen a lot of new diagnoses at Ward 86. So that's an anecdotal observation. And many of these new diagnoses are in women and populations that we hadn't seen so much before. So now only with systematic testing will we know the impact of transmission.
While HIV healthcare providers became increasingly alarmed with the direction of prevention and treatment, no one seemed to be paying attention. Dr. Gandhi witnessed that increasing neglect even before the rise of COVID.
I think that was already happening even before COVID, this idea that in a way, if you have the treatment and prevention, then everything's fine. And in a way, it's a very interesting analogy to what's happening right now with COVID, because we do have treatments, we do have prevention, and it's true that we'll have to manage it going forward, but we have to incorporate it into our sort of medical systems. And HIV, the public perception may have been that we already have all the advances that we need and it's kind of done. And I think that's true, because I think that was happening leading up to the International AIDS meeting in 2020. I was co-chair of the International AIDS meeting that was supposed to be July of 2020 in San Francisco and Oakland. It was the first time it was coming back in 30 years to our area, and it was really going to be a big deal, but it was also going to be an event that we were hoping to generate a lot of people remembering HIV and that it's not over, and it's certainly not over for really vulnerable groups. But then, of course, that meeting wasn't held. It was held virtually, but it wasn't held in person, and it really fizzled. And we were unable, I think, to draw back attention to HIV, which we were hoping to do in July 2020.
And then on December 1st, 2021, Gandhi realized just how far off the radar the issue had gotten.
It was World AIDS Day, and it was the 40th anniversary of the first description of AIDS, which was in 1981. So we were anticipating quite a bit of interest in World AIDS Day in the city of San Francisco. That was the epicenter of the pandemic. And we thought there'd be press and a lot of people contacting, different AIDS organizations. And we went and had a rally on the steps of City Hall, and there was very few people at the rally. And I was speaking in my position as medical director of Ward 86, but I kept on being called by the press, and I was very excited because I thought they wanted to talk about World AIDS Day, but they were actually calling me because it was the first description of the Omicron variant in the United States had been identified in San Francisco that day. And I'd been doing a lot of media for COVID. And so where the press was calling me was actually to ask me about Omicron. And I found that really surprising because they, in fact, pulled out of coverage. One press organization pulled out of covering the World AIDS Day event that we were having. And they said to me, if you come around the corner and talk about Omicron, we could talk to you. And I said, no, I'm doing World AIDS Day right now. So we didn't end up meeting.
What do you account for overlooking World AIDS Day?
I think that this city in particular, San Francisco, had a very conservative response to COVID. It was the whole Bay Area did, and then California in a larger way had a very kind of more lockdown approach to COVID, a lot of focus on COVID. It's hard to tell the California outcomes. I think that's all being sorted out, but certainly San Francisco had good outcomes with COVID. But it was that kind of focus became, even after 2 years, quite myopic on a single infection, a single disease. And it seemed like other problems in public health were forgotten. But what seems surprising about specifically forgetting HIV is that HIV was something that was a really important part of the fabric of San Francisco. Like it just, that this particular infection and all the political advocacy around it was really woven into what I thought the mayor always thought about, the supervisors, the people of San Francisco, the patient groups, advocates, clinicians, researchers. It just was such a part of the city. It's why I came to San Francisco for my training and stayed. So I was surprised that particular day. I was already concerned that a lot of other public health problems were not being paid attention to prior to that, substance use and overdose deaths being my biggest concern. But that day really hit me that the focus on this variant was taken away from a really important memorial.
Rally organizer Paul Aguilar is a long-term HIV survivor and chair of the Harvey Milk LGBTQ Democratic Club's HIV caucus. He called on the city to take back HIV as a major priority.
The viral suppression rates among the homeless population in San Francisco who are HIV positive before COVID was at about 40%. So 40% of them were virally suppressed. And the last epidemiological report showed that it was only 20%. Now, San Francisco has made a promise to get to zero by 2025, and if that continues, they're not going to make that. So what we're asking the city to do, the Board of Supervisors and the Human Rights Commission, is to conduct an investigation to see to what extent COVID has actually impacted the HIV service network and the safety network here in San Francisco.
City Supervisor Hillary Ronan was on the steps of City Hall that day in support of the campaign's message.
Since COVID and the housing crisis and the fact that there's amazing new medications to treat HIV/AIDS, we've taken our eye a little bit too far off the ball, and we need to refocus back until we get to zero. This needs to continue to be a top priority for the city. It's something we pride ourselves on, and we need to continue to be at the cutting edge and leaders in this area.
Is there anything that you specifically intend to do and intend to bring forward to address this?
Not specifically. I'm the new budget chair, but what I absolutely will do is we're not cutting a cent of HIV funding from this budget. I don't think the mayor will either, but if the mayor did, then we'll restore it at the Board of Supervisors, and then we'll see what comes in terms of any new funding requests, and we'll consider them, as top priorities.
At a Budget and Appropriations Committee hearing on May 4th, Ronan talked about her moment of enlightenment when it came to funding HIV prevention and treatment in San Francisco.
When I was a legislative aide for Supervisor Campos, and there was a possibility of cutting some of these funding, my coworker at the time, Nate Albee, said, absolutely not. We are not cutting a cent from HIV funding. And I was like, well, why? Haven't we gotten control of the virus? And he said, go home and watch How to Survive a Plague. And I went home and I watched How to Survive a Plague. And I said, under my watch, we will never cut a cent of HIV funding ever. And it's become a huge priority of mine. So for anyone listening and out there who doesn't understand why this is so important and doesn't understand the first pandemic that so many people survived or so many people didn't survive in this city during the 80s, and the discrimination and the hate and the fight that this community put on for their very own survival. It's one of the best documentaries I've ever seen. It changed my entire understanding of this fight and what it means, and I highly recommend How to Survive a Plague. Anyone who hasn't seen it, go home, watch it. It's that impactful.
During the committee hearing, Department of Health officials reported on the state of HIV funding and programs. The presentation showed that federal funding has steadily decreased over the past 20 years from $37 million to $15 million. But it's been replaced by city funding, which is now at $22 million annually, so the dollar amounts have remained steady. The number of residents living with HIV has also remained steady at around 15,700. The number of virus-related deaths had been consistently going down until 2021, when it rose to 160 deaths from the previous year's 137 deaths. Numbers by demographic indicated a disparity in diagnoses and viral suppression between the white population and the Black and Latino populations. While diagnoses among whites reduced dramatically over the past 10 years, it lowered only slightly among Black and Latino residents. And residents who lack permanent housing were especially vulnerable, with a viral suppression rate of only 20%, well below the 70% goal for 2020. Tracy Packer, the Director of Community Health Equity and Promotion at the Department of Public Health, explained that a new funding formula will address equity.
We met with multiple community groups, about 160 people, to get their input on how to address the disparities that we've been seeing. And this is the outcome of that process. They said we needed to develop community-centered approaches and integrate services. We needed to focus on social determinants of health, such as housing and mental health, for people living with HIV and people who are at risk. So a status-neutral approach where everyone could join. To fully integrate HIV, hepatitis C, and STD, and harm reduction, overdose prevention, and ensure that we use a racial justice and racial equity lens. In order to implement the recommendations of the community process, the DPH developed a model called Health Access Points, or HAPs. And these are equity-focused, community-centered, whole-person care approaches to integration of HIV, hepatitis C, and STI, and are a whole-person, one-stop shop, population-specific site or center.
But some fear the new approach will further destabilize HIV treatment and prevention. That's because long-established support organizations may see massive budget cuts. The city has invited organizations to submit proposals for how they would provide services, and that's led supervisors to become concerned about a loss of funding for legacy organizations like one of the city's oldest groups, the AIDS Foundation, and the city's only Spanish and Portuguese support group, Aguilas. Ronan questioned the funding process.
What happens to those organizations that all of a sudden have massive holes in their budget and are not going to be able to continue the work with individuals that they've gained a reputation serving? It doesn't appear obvious to me, and certainly to the community. I'm sure we're going to hear a lot of public comment about this. Are the new organizations that are being funded, where all that money that is going to be diverted, do they have that same history and level of engagement and work with the communities that they're serving?
While still unclear where the funding will ultimately end up, Packer tried to ease concerns.
The agencies that are going to be funded were scored the highest, which indicated that they're able to do that work. All of the agencies have experience in the work with the community or with HIV prevention or both. And one thing that you didn't exactly ask, but I think I'll answer anyway, is if an agency is not providing the service, then who will? And the new agencies will. So for example, if there was a strong testing program, then one or all of the new agencies, the newly funded, I'll call them because they're not new agencies, would be providing that testing. Will there need to be some capacity building and strengthening? Yes. And we actually have funding set aside for that, for ensuring that all agencies can shift as they need to.
Laura Thomas, Director of HIV and Reduction Policy at the San Francisco AIDS Foundation, called into the hearing to warn supervisors about the dire impact reduced funding would have on the community they support.
While we support the goals of the HIV prevention RFP, we are concerned about the unintended consequences on the HIV prevention safety net, particularly during the first few years of services when other organizations have yet to ramp up their prevention and care services. Here at SSAF, we maintain approximately 3,000 clients in our PrEP program, a significant proportion who are Black, Indigenous, and people of color. We conduct more than 10,000 HIV tests yearly and consistently identify nearly a quarter of the city's new HIV cases. We also provide hundreds of clients with low-threshold substance use counseling and support and community support. These are all services that will be impacted by the change in prevention funding, resulting in a significant change in the availability of free and accessible services in our community. Wait times at our already busy sexual health clinic for PrEP appointments will increase. Availability of HIV testing and early treatment services in spaces the community already accesses may decrease. Behavioral health and substance use services, already severely lacking and underfunded, will be impacted. I urge you to consider the serious ramifications of this change in funding to HIV services and a plan for deficits that are likely to occur in services available to the community. We've made hard-won progress in turning the tide of the HIV epidemic. I urge you to keep this momentum by ensuring that our strong systems of care continue.
At a May 10th Board of Supervisors meeting, Supervisor Raphael Mandelman said the Department of Health report and presentation didn't alleviate his worries. He proposed a resolution urging continued support for legacy providers of HIV support services. The resolution also called on the mayor to fully fund the more than $10 million budget request from the HIV/AIDS Provider Network. That's a coalition of community-based nonprofit agencies that serve people living with and at risk of HIV/AIDS in San Francisco. The funds would save HIV prevention and treatment services currently slated for cuts and go toward expanding mental health, acute behavioral health, and overdose prevention services.
While the 2019 RFP was crafted with the intent of improving equity and access to HIV/AIDS prevention and treatment services, DPH has not planned for the destabilization that will result from cutting millions of dollars to legacy organizations that are known and trusted by many long-term survivors and are responsible for the successes we've had in getting to zero in San Francisco AIDS Foundation's case, and specifically targeting the most at-risk group in the case of Aguilas. Additionally, impending cuts to organizations like Aguilas, which is the only service provider with English, Spanish, and Portuguese capacity in the city, raise questions about whether the RFP is accomplishing its stated goals, namely creating an equity-focused, community-centered, whole-person care approach. Again, thank you, Supervisor Ronan, for calling the hearing on this issue. I think you, and I know I, found DPH's inability to explain how they will prevent these cuts from severely destabilizing our safety net concerning, to say the least. I've expressed those concerns to the mayor's office and DPH leadership and will continue to do so until they've committed to sustaining the city's existing HIV/AIDS safety net, even as they build capacity at new organizations. And I want to be clear, I am not opposing that capacity building. I think it's important and will be an integral part of getting to zero for everyone, but I am against building that capacity at the expense of the legacy organizations that provide life-saving services every day and are responsible for San Francisco's great successes. So thanks to the HIV/AIDS Provider Network and the organizations on the front lines of our fight to get to zero for all your advocacy and for holding the city accountable.
For now, the fight to get to zero is the best and really the only approach to mitigate the harm of the relentless virus. Dr. Monica Gandhi explains. Do you ever foresee a time when there's actually going to be a cure?
It is a difficult problem because HIV itself is a retrovirus, which essentially by its very nature, its genetic material intercalates into our genetic material. And so we live with HIV chronically. There have been some exciting ideas about it, but the only 3 people who have been cured of HIV, it was through transplants. They had cancer, and it wasn't something that could be replicated on a grand scale. So though cure is absolutely a very important research agenda, and I really hope that there will be a cure someday, just like vaccines, it's for HIV, it's biologically, it's more daunting.
Meanwhile, there are over 10,000 people living with HIV aged 50 or over in San Francisco, many of them long-term survivors of HIV who have endured the years before HIV became a manageable condition. The May 4th hearing was also an opportunity for them to remind policymakers not to overlook their unique circumstances. Among them was long-term survivor Harry Bro.
I've recently turned 77, 42 years of that living with HIV. 15 living with a 2-year death sentence, and 26 with full-blown AIDS. I've been very lucky. To the casual observer, surviving HIV/AIDS is a good thing. Yet, as outlined in the San Francisco Principles, many of us are challenged by mental exhaustion, depression, substance use, underinformed health care providers, housing instability, unemployment, expiring insurance benefits, poverty, and stigma. For our support, we depend on the many nonprofit health organizations that are challenged by a lack of funding and are particularly unable to fully actualize the services needed, especially by the lower income, underrepresented, and disadvantaged minorities in this city, often resulting in an increase of HIV transmission.
The set of guidelines known as the San Francisco Principles was released on September 18, 2020, by a group of HIV long-term survivors and advocates to mark National HIV/AIDS and Aging Awareness Day. The statement centered around the mantra, "Nothing about us without us." Inspired by the 1983 Denver Principles, one of the first statements of self-empowerment by people living with AIDS, it calls for inclusion of long-term survivors in policy decisions. They advocate for people infected before the 1996 introduction of antiretroviral therapy. Many of them still suffer from debilitating PTSD after living with the fear of catching or spreading the disease, losing entire social circles, being ignored by public health officials, disregarded by politicians, and condemned by religious leaders. Not to mention putting their bodies on the lines for early toxic treatments. San Francisco Principles author Paul Aguilar also pleaded their case at the committee hearing.
The first pandemic showed up 2 weeks before my 18th birthday in June of 1981, and by that August, my first close friend had died, and they haven't stopped. My friends have been dying for 40 years. Death, or the specter of it, has been my constant companion every day for 40 years. And when you live with that kind of loss, that kind of catastrophic grief, it takes its toll. Now, we long-term survivors are mostly forgotten and overlooked. During budget talks and program planning and sessions, we are shoved to the side while prevention methods such as PrEP and syringe access get everybody's attention and focus and funding. And while we support those efforts towards ending the AIDS pandemic, we insist that these prevention efforts not drain resources for caring for those of us who have been living with HIV for 30, in some cases 42 years. Now, let's face it. Getting older isn't easy for anyone, but getting older with HIV, that's difficult at best. Nationwide, 50% of those living with HIV are over the age of 50. In San Francisco alone, it's 72%, which is why back in September of 2020, my colleagues, some of them are here, and I wrote the San Francisco Principles. It outlines our daily challenges as we face and our demands for inclusion and resources and funding and care that addresses our specific needs now. And just as San Francisco set the global standard back in the 1980s, we're asking that it do so again. And one way to start is by recognizing and adopting the San Francisco Principles at a citywide level. And not just within the city departments, but within the agencies that the city funds as well.
Mayor London Breed is expected to present her balanced budget proposal for city departments on June 1st. The Budget and Finance Committee holds public hearings in May and June. The committee then makes recommendations to the full board, which has to approve the budget by August 1st. Finally, the mayor reviews it for final passage. Every year, the San Francisco AIDS Foundation HIV Advocacy Network campaigns for certain city budget priorities. The largest ask for the upcoming budget is $3 million to house 1,500 people living with HIV over the next 5 years. The group reports that nearly 1 in 6 people living with HIV is severely rent-burdened, unstably housed, or experiencing homelessness. These circumstances have a direct impact on health since people in these situations are far less likely to be virally suppressed. That can also lead to higher transmission rates. Writer and activist Hank Trout explained why people diagnosed with HIV/AIDS before the existence of antiretroviral therapy might need more help accessing affordable housing, mental health care, and financial support.
I'm a 33-year survivor of AIDS and one of the co-authors of the San Francisco Principles 2020. Rather than discuss specific policies, I'd like to remind you exactly why most of us long-term survivors find ourselves in this position. In the 1980s and early 90s, when our HIV diagnosis was a certain death sentence, our doctors advised us that the best thing we could do for our physical and mental health was to quit work, live on disability insurance for the short remaining time we had, get our affairs in order, and prepare to die. And many of us did so. We quit work and prepared to die. And then a funny thing happened. We didn't all die when we were supposed to. At the prime of our lives, we should have been investing in our future, continuing our education, creating families, and settling into a reasonably comfortable life. Instead, we were kneecapped by a virus and thrust into crippling poverty. Suddenly, on top of the grief and the PTSD we suffer after losing dozens upon dozens of our friends to AIDS, we were forced to navigate living in poverty in this very expensive city. The mental, emotional, and physical effects of that continue to plague us day after day, year after year. We need more housing subsidies for people living with AIDS and HIV who cannot afford $3,000 per month for a one-room studio in the Tenderloin. We need economic assistance to be able to afford the luxuries of life, like food. We need far more funding for mental health services to deal with the PTSD and grief.
I'm Sylvie Sturm, and you've been listening to Civic. Civic is produced by KSFP-LP, a project of the San Francisco Public Press. Our team includes producer Leanna Wilcox and contributor Mel Baker, who's also program director for KSFP. Our theme music is by John Dillon. Thanks for listening.